Hello, good morning. My name is Farhan. So today I will talk about the plantar fasciitis. Plantar fasciitis, as we know, also called as a jogger's heel or tennis heel, is actually one condition is caused by the irritation at the plantar fascia. The plantar fascia itself is actually one structure or one layer of the ligamentous that covering from the heel up until up front of the foot lah. So the function is to allow the cushioning for the foot while the people is walking. So the etiology, the causes of the plantar fasciitis is actually caused by irritation. So we can, other than that, the causes we can divide it into two, which is intrinsic and extrinsic. Intrinsic is because of the structural risk factor by the people itself. So like pes planus, pes cavus, or the overpronation of the ankle, which can lead into the increase the stress to the plantar fascia. So other than that, is can caused by the length discrepancy for those having a trauma, okay. So or the congenital disease. Other than that, it can be also because of the obesity. So all this, the intrinsic factor, is actually will causes the biomechanical dysfunction to the anatomy itself lah. The second etiology is the extrinsic, which is the extrinsic is outside from the body, which is for example the training errors, suddenly increase of the intensity of the training or duration or the distance lah. Or it can cause also by the if the people or athlete are wearing the inappropriate sports equipment like poor shoes, insole, or etc. So for the incident of the plantar fascia, peak age people who can get the plantar fasciitis is about 40 to 60 years old, and then the woman is more tendency to get compared to the men lah. Patient or people will come to the doctor or the the physicians with complaint of the sharp pain at the heel, usually at the morning lah, when the people try to make a few couple of steps in the early morning, and then it can worse if people walk in the barefoot or climbing the upstairs, and then the pain can be relieved after do some stretching or unloading the affected leg. So for the examination, we can check for the plantar. Usually the people will claim the pain when we palpate at the proximal part of the foot, actually the calcaneum bone, and then and also we can perform the windlass test, which is we reproduce pain by the dorsiflex the big toe, and then usually the people will complain of the pain if you do that. So for the other disease, we can differentiate diagnosis for the plantar fascia. We must rule out for the bony fracture or the fascia tear or the fat pad syndrome, and also for the neuropathic pain lah. So how about the management of the plantar fascia? We can divide into two, which is conservative and non-conservative. The conservative part we can divide into two, non-pharmaco and pharmaco. For the non-pharmaco, usually we do rest up to 2 weeks, up to 6 weeks, and then we can perform also for the ice massage. Put the water in the bottle and then freeze it, and then ask the patient to massage with the ice. Or we can ask the patient or teach the patient to do some stretching to stretch or to make the plantar fascia elongate, such as put the foot on the flat surface or on the floor, and then we ask the patient to bend the knee and then when bend the knee, automatically the ankle will become the proxiflex. So this is one kind of the stretching. Other than that, we can teach also for the strengthening part, which is calf raises, or train the intrinsic foot muscle such as, for example, do the tower curls or marble pickups, and also the toe taps. And then we can also, if the pain is severe, we can help the patient to put some taping, and then maybe we can refer to physio for the shock wave therapy lah. So for the shock wave therapy, there is a few theory. One is to stimulate the blood flow, and then the second to re-inject the tissue for the stimulate the healing, and then the third one to shut down the neuronal pain pathway lah. So that is a non-pharmaco. For the pharmaco, we usually give the medication like an NSAIDs, or we can also for the corticosteroid injections. So if the conservative part is failed, then we can move to the we call that is a surgical intervention lah. We can refer for the ortho surgeon. Then they will check either we can do the fasciotomy or not. So for the prevention of the plantar fasciitis is as first we can educate the person to the proper warm up before the training, proper stretching, and then must do the gradually increase the intensity of the training, and also must wear the appropriate sports equipment. Okay, right. So.